Today I'm going to explain about two clinical trials which are going on about the COVID-19.
Okay.
As we know, this coronavirus detected in the 2019 in Wuhan, China. In January 7th, 2019, they detected in the library, and then first case was in 2019, and then they discovered about the virus in 2027 January. And in 10 January, they could detect the pathogenic nucleic acid. And then after that, it became an economic disease in the epidemic disease in the Wuhan, and then it's spread all over the China. And then now, as we know, it's all over the world. And then we are calling it as severe acute respiratory infection, or in short, SARI. And then up to February 4th, 20,000 person has been diagnosed with that, and then 4.6 people has been died. But now, as we know, is more near 40.
Samir, can you speak little loudly?
Okay, okay.
Put mic little closer. No, mic only you put little closer.
Now near 40,000, 4 lakh people has been diagnosed with coronavirus, near 4 lakh, and so many people are dying because of this. So there are so many controversial topics about the treatment of COVID-19. As we know, there is no proper treatment for that. But so many people are talking about some preventive measures like taking vitamin D or taking vitamin C or any other kind of thing. Here we are explaining two uh, clinical trials which are going to answer these questions.
Okay.
First is about the vitamin C infusion for the treatment of severe 2019 nCoV infected. So there was a controversial topic in so many places before that is the vitamin C is a good option
Sorry,
for
voice is very
pneumonia
low.
or not.
Samir, are you speaking with through your earphone?
But I cannot shout.
No, I'm asking you. Are you speaking by using
Yeah,
that
yeah,
earphone?
I'm checking with the
Okay,
earphone.
just once you remove your earphone and check.
Okay, okay.
Okay, now you try speaking in.
Is it better
Will
now?
it be? Yeah, I think slight better. What do you say, Abul Baji? Now you speak.
Okay. As we know, vitamin C is a ascorbic acid. We all know it has ascorbic acid and it's an antioxidant. And it has been seen that it is effective in some diseases which are affecting the lungs, and even in the simple cold and sepsis. But here in this study, they are going to assess whether vitamin C infusion can be effective or not for the treatment of uh, COVID-19. Just 1 second. Okay. They have done a study previously in 52 students, and then they have seen the reduction of symptoms, not in the COVID-19, in the some flu and influenza patients. And also, they have seen in sepsis and ARDS, patients in high dose vitamin did not show better prognosis. So there are controversial topics that exactly whether vitamin C infusion can help or not.
Mm-hmm.
This study is a kind of interventional study. 140 participants will be enrolled and then it randomized. And it is in parallel assignment. Trial will has started in 14 February and it will be over in the September 2020. So it still is going on in China. And then it's here is inclusion criteria. More than 80 years old, diagnosed with COVID-19. Then exclusion are those who are allergic to vitamin C, dyspnea, they have dyspnea or pregnant, breastfeeding, expected life less than 24 hours. It means that those who are very in severe cases, and then those in a state of tracheotomy and home oxygen therapy, those will be excluded. And the patient with the end-stage Lyme disease, end-stage malignancy, glucose 6-phosphate dehydrogenase deficiency, and active kidney stone disease will be excluded from this study. Here I will explain about why they are going to uh, exclude these patients. And there are some case studies which are reporting that those patients with glucose 6-phosphate dehydrogenase deficiency, or in short term we are calling it G6PD, uh, when they are taking high dose of vitamin C, it is the chances of hemolysis.
Okay.
And then case of kidney stone, uh, it will vitamin C high dose increase the chances of getting more uh, kidney stone. So the outcome measure, primary outcome measure for this study will be ventilated 3 days for 28 days patient without ventilation support, and secondary outcome will be 28 days mortality, whether the patient survived or not. And third one is ICU stay, how long the patient is going to stay in the ICU. And fourth one, demand for first aid measurement, the rate of CPR. One is vasopressor days, how many, even it's like that after 28 days, patient is going to use vasopressor or not. And respiratory indexes will be the oxygen pressure, and then how respiratory is functioning. And two last one is APA CHE score, which is dealing with the assessment and chronic health evaluation. It will ask about the so many criteria, and then the minimum score is 0, and then maximum is 71. And then next one is SOFA score, which is also dealing about the, it's a short form of sequential organ failure assessment score, previously known as sepsis-related organ failure assessment score. Is used to track a person's status during their stay in intensive care unit ICU. It is also related to the, uh, the respiratory, cardiovascular, hepatic, coagulation, renal, and neurological system. According to these criteria, we are going to score the patients. So uh, these are the about this study, which is going to be published in short time about the effect of vitamin C in COVID-19 cases. Second trial is about the efficacy and safety of corticosteroids, especially methylprednisolone, in the treatment of COVID-19. This is all another controversial topic. So many doctors are believing that glucocorticoid will help the patient, those who are very in severe condition, and some are believe that corticosteroid cannot be effective, and more it can be also dangerous for so many patients. This is also another interventional study, 400 participants, randomized, single group assignment. Uh, is an open label study. Yes, it started in 14 February 2020, and it will be going to over in 13 May. And the drug is methylprednisolone 1 mg per kg per day, IV for 7 days. Inclusion criteria: age more than 18 years old, and then yeah, and the patient is diagnosed as a COVID-19, admitted in general ward, and being able to sign informed consent. It's showing that they are more searching for those patients who are in a stable condition, not very severe, or they cannot assess them. Exclusion criteria: those who are using severe immunosuppressants, or in HIV infection or long-term use of immunosuppressive agent, pregnant and lactating period women. Glucocorticoids are needed for other disease, unwilling or unable to participate or complete the study, participate in another study. Okay, in this study, the primary outcome is a clinical symptom and sign continue to deteriorate, or new pulmonary or extrapulmonary lesion appear, or chest imaging indicate the progress. So it's showing that the primary outcome measure is if the patient is worsened, condition is worsened after 14 days, we stop the treatment. But the secondary outcome measure about the clinical cure incidence in 14 days. Symptoms and signs improve or elevate. The temperature being normal, respiratory system improve significantly, imaging show obvious absorption. And no additional or alternate treatment was needed. This is the outcome which showing that the treatment was effective. The duration of virus change to negative, the duration from admission to virus negative. Mortality at day 13, the patient died in 13 days. ICU admission rate in 13 days, the patient transferred to ICU because the clinical death rate in the 13 days. Mostly they are going to that whether it's effective or not. They are not showing they are not seeing the effectiveness only. They are seeing if it was not effective also, they will conclude it as not non-effective. I mean, both the sides they are going to evaluate whether it is effective or not. Both the measures they have established. That's all.
That was really nice information. I think not only these two, there are still many clinical trial going on. Of course,
Yeah,
these two evaluated of vitamin C and methylprednisolone. And for example, now we are getting to know that the bronchodilators, theobromine and methylxanthine, because these are respiratory drugs. Even these are found to be very helpful. But still, since there is no confirmatory thing, but I think many it has been proven, some says, but I think many controversies are there. So there can be there might be going plenty of research around this also.
yeah, many
So anybody
studies.
have?
Yeah,
Yeah, yeah, go
yeah.
ahead.
I saw
Yes, Samir.
another study. It was talking about the effectiveness of vitamin D. This is also
Yeah.
some rumors are going on in the social medias about the effectiveness of vitamin D. That study was showing that vitamin D, even it cannot be effective and even it can be worsen the condition. It can allow
Um,
the virus to enter to the cells more rapidly because it increases
oh,
calcium channels.
is it?
If I saw another study, I couldn't include in this because it was very lengthy. It was
Mhm.
not in the
Yeah, that's interesting part that you are telling the vitamin D can worsen the condition by increasing the intake of virus into the cell. But what we generally expect is like even in case of sepsis, we say that's also kind of infection, um, and many other infection. But we assume that from our theoretical knowledge that vitamin D will improve immune system, and that's how it may facilitate to fight against the infectious disease. But as you are saying now, it's controversial. So that was new thing for me and for many people in this class. I think that vitamin D can aggravate the condition.
yes.
If anybody
I
in the
can
coming
I can show you the article later on. I can send for you.
no
So
problem.
how does it aggravate the condition?
That's what he will say that article. It talks like it will increase the uptake of virus into the
Yeah,
cell.
it will affect. Yeah, because this virus, not the COVID-19. I'm not saying the COVID-19. Totally the
But
virus.
in
This
in
study,
general infection,
yeah, in
and
general,
we all know that there is a relationship between vitamin D and calcium.
yeah.
So this again could be just hypothetical
It
or
is also,
practical,
yeah, hypothetical. Yeah, it cannot
hypothetical
be
thing.
completely.
But I think what data we already have is vitamin D by strengthening the immune system can help in infection. That is already proved, I think.
Yeah, correct.
Yes, yes. That's what like it boosts the immune system. So it's contradictory that you were saying
Hmm.
it will worsen the conditions.
Yeah, that's what has to be verified with the research and doing trial. They have to confirm it. Okay, anybody else have any question that you would like to ask with Samir? No questions? No questions?
Why vitamin C allergy has been excluded, sir?
See, because you are giving vitamin C, if the patient is already allergic to vitamin C, how can you include them in the group? Hmm? That makes sense, right?
Yeah, it's very clear.
If the patient is already allergic to vitamin C and you want to check the effect of vitamin C, how can you group such patient? Did you get Abdul Rahman?
Yes, I got, sir, but okay, I understood.
Okay, go to the next slide, Samir. Your exclusion criteria of the next study. Okay. So in this, generally, in what condition you see the injection methylprednisolone given? What in our general practice, I think what we have seen is mostly in the critical setup, whether the patient in ICU, STU, or HICU, isn't it?
Yes, yes.
But here they are choosing very stable patient. I mean to say, like you can see admitted in general ward. So that's what I was thinking about. What would you like to say about this, Amit?
Yeah, correct.
And even methylprednisolone is more potent than
See,
compared to
totally,
hydrocortisone.
because the severe condition which is going on, and then
Mhm.
nothing can be predictive. It's not predictable. I
No, I
think
think there might be
they are
nice logic behind this, which can explain okay why. Because anyway, they could have chosen the patient which are even in the critical setup. Why they limited themselves? Like that was wondering.
I can again search about it and inform.
No, this is
I
just
will.
my doubts and my thoughts
Ah,
that I thought of. Okay, anybody else? Any questions to the Samir? Okay, no raised hand, Samir. Okay. So shall we disperse?
Yes.
Hmm?
Yes, sir.
Okay. Thank you, sir. Thank you all. Okay. Have a good day.